Hi guys, Dr. Gerald Vargas here. I wanted to do a tutorial on TMJ issues and as a chiropractor and as a dentist, what you should be looking for, particularly when you're assessing for TMJ dysfunction. Primarily, there are three main reasons why people have TMJ issues. And the first reason is because of having an issue between the condyle and the disc. And so if we look at the compartment of the TMJ, we're mostly dealing with the relationship between the condyle and the fossa, but also in between the condyle and the fossa, we have the intra-articular disc, which is acting to allow that sliding and rotation to occur for the TMJ. Now, if we look at the TMJ movement, what we want to assess primarily is the first thing is how much rotation or how much translation is occurring as they open and close their mouth. Now, what we know initially when someone begins to open their mouth, most of the movement should be in rotation, at least 25 millimeters. So you should be palpating the TMJ and feeling for that rotation as they start to open their mouth. The next phase should be a translatory phase where the jaw starts to move forward. It starts to translate forward, and that should equate to another 25 millimeters as well. Lateral deviation is 12 and protrusion is 6. And this is one quick way of being able to assess how much rotation, how much translation, how much lateral deviation and protrusion are they getting, and is it falling within the normal limits. So when we start to look at issues of condyle to disc problems, what we generally tend to find is these patients will be able to open and close their mouth properly. Their range of motion is fine, but it's sore. And it's usually where most TMJ problems begin. So these type of patients often will respond well to either some acupuncture or laser or nutritional advice, and even just some mobilization within the jaw to loosen up some of those tight muscles, whether it be the masseter or temporalis or even below the jaw into the digastrics. The next stage of dysfunction that we look at is the condyle to fossa problem. Now, the condyle to fossa problem usually comes about because of where the final stages of closing, where the jaw and the teeth start to look at where they need to match up. Now, generally, it'll happen because of a condyle that is either moved too far posteriorly, backward, or it's gone too lateral as well. So this can sometimes happen if we start to lose the vertical height of the molars. That can drive the condyle posteriorly. If we're having issues with a retrognathic maxilla or a prognathic mandible, that can also drive the jaw or the condyle posteriorly. And also if they're in a division 2 bite pattern, what will tend to happen is they'll want to avoid those teeth coming together, so they'll drive their mandible further backward. And this is often an easy problem to fix in the scheme of things, because the issue is looking at proper development of the mouth, but also where do those teeth want to actually move to? And that can be driven by a displacement within the cranial bones. So particularly where the temporal bones on either side are not matching up, and often will involve mobilization of those bone structures to facilitate a better positioning of the cranial bones. So this is where cranial work can be really, really beneficial to helping these patients, as well as obviously working with a great dentist. And probably the most difficult case, and this is probably where I get most questions being asked, is what does the clicking actually mean? The clicking is usually a fossa, a disc to fossa problem, which is where now you're starting to create a sprained joint. The tissues of the retrodiscal tissue we know are the most pain sensitive, whereas the central portion of the TMJ or the temporomandibular disc doesn't actually have pain fibers. So a lot of the time, these patients may not complain of pain when they're having this clicking action going on. But the problem is that the more clicking they're getting, and particularly when and during the phase of opening, can actually start to create more complicating factors for that patient, particularly where their jaw may be locked open or where they're locked closed and they can't actually open their mouth. So it does become a problem, but the main thing that we're looking at is when are they clicking during the phase of opening and closing. And an easy way to look at that is if we start to notice that during mouth opening, they click on early or they click on late and they click off late, then that's not necessarily a great sign. Why? Because what we're seeing here is where the joint now is starting to become too lax. The retrodiscal tissue has now become stretched enough where the ability that the disc has to relocate or reduce back onto the condyle is compromised because of that retrodiscal tissue has become so stretched that it's now having to be stretched to an extreme amount before it now actually reduces back onto the condyle. So not a great scenario. The better scenario would be if during mouth opening, if they tend to click on early and they may click off early as well during mouth closing. So that's a better sign. So either way, during clicking, they will need to have that jaw stabilized. They will need to have perhaps a dental orthotic, particularly in the previous case where we're getting a late clicking on and also a late clicking off. What we want to be able to make sure is that you're able to know how to manage these patients. But these, certainly with clicking, you want to be able to manage it with a great dentist as well. So another way of assessing if you are looking particularly at a condyle to fossa issue, where you're looking at movement, is how does their jaw move during mouth opening and closing? So as they move, are they moving along the midline, or is their jaw now starting to deviate towards the left or to the right? Okay, or do they do something like a squiggling action or a Z-shape action as they open their mouth? The other thing to note is how much lateral deviation are they getting. Are they getting the full 12 mils either side, or are they starting to move towards more 10 mils on one side and 8 on the other? Okay, and as they protrude, is their protrusion symmetrical in the midline, or are they starting to deviate to the left or to the right? So these becomes very important, particularly when we're tracking TMJ problems, because we want to make sure that they have good, not only good movement, but also that their movement is symmetrical. And this is where, particularly with condyle to fossa problems, this is where using something like an aqualizer, which basically will take off pressure into the TMJ, particularly during those late phase of closing, where the teeth are starting to look at where they're going to end up. So particularly whilst the cranium is being addressed, to create that balance and making sure that the neck is in a good position. So how does airway end up affecting these type of problems? Well, one of the things that we notice when there is airway issues is the head will tend to want to translate forward. And being in that position, what it does to the cervical spine, the neck area, is that it reduces the curvature. But it also will tend to cause the jaw to sit further back. And it can create more condyle to fossa problems. So one of the things that we want to make sure is the breathing has to be right. The head position has to be in the right position in order for the jaw to be able to move properly. Otherwise, you're going to start to have problems with how that jaw is able to open and close. And one of the things that we really want to make sure is that they're getting proper rotation as they open and close their mouth. Now, why is that important? Because generally, if there's pressure too much within the retrodiscal tissue, or if there's a problem with the head being in a forward position, what will tend to happen is the patient may want to translate too early. And the problem is that you start to then have an issue where instead of the disc now being compressed completely as that jaw starts to rotate, it's only partially rotated. So you have a disc, you have a condyle to disc relationship which is not in a closed pack position. So that area is not stable, before that jaw starts to translate. And that's where you start to have issues with now an upper compartment problem, which is now you're dealing between the disc and the fossa, where because of the poor translation or the poor relationship between the condyle and the disc, now you're starting to have problems with that tissue now being stretched too much because it's not in a closed pack position as it's supposed to translate forward. So really what we want to make sure is to make sure that the jaw is rotating within its normal range, within 25 mils. If it's not, it's very, very important that you work with a chiropractor or a practitioner that's able to assess and to be able to work with the mechanics of the jaw and to loosen up those structures. Why? The other reason is because when we look at the function of the jaw, we know that the function of the masseter muscle, as it moves through onto the zygomatic bone and attaches onto the ramus of the jaw, of the masseter will move the condyle in an anterior superior direction. And that's really where most of the pressure should be within the condyle as it moves up as the jaw starts to close. The problem with a lot of TMJ issues is you don't get a lot of activity of the masseter, and then the temporalis starts to become too overactive. And then the problem is that drives the condyle now not only in a superior direction but in a posterior portion of the fossa. And that's not the most ideal. So we want to make sure that the condyle is sitting superior anterior because of the action of the masseter, where 90% of that force should be in the superior anterior portion of the fossa. You only have 10% of the force being distributed superior and posterior because of the action of temporalis. So hopefully that gives you more information about TMJ dysfunction. If you'd like to ask further questions, please feel free to comment below or just like the link as I've listed below. Thanks again for your time.